Thank you very much. I'm so pleased and honored to be invited here. It's my first trip to Luxembourg. Aside from the weather, it's very beautiful, but it's a real pleasure. And I understand I will speak for about 45 minutes and then take questions. So let me begin. I just want to give you an outline of what I plan to cover in the next 40 minutes. I first want to talk with you. I will emphasize primarily the American literature on this topic, although there are many commonalities between what I will talk about and what we see in European countries as well. Although I'm not an expert on European data, as many of you in the audience are surely. But I'll talk first about what we know about differences in many important markers of child development in both what we call cognitive skills, like academic achievement and test scores, as well as non-cognitive skills, such as behavior and attention and mental health problems. And we see regularly large gaps between economically advantaged and disadvantaged children across numerous measures. I'd like to describe some of those findings for you. I'm then going to turn my attention to the thing that I care most about, which is the role of parents in children's development. I am a believer that parents matter a lot, that parents are children's first teachers, and that, as I will describe to you, children spend vastly more time in the company of their parents than they do in any other institution. And therefore, if we are concerned about closing the gap between rich and poor children, or the children of college-educated parents versus those who have much more limited education, we really must turn our attention to the role of parents. We have done so in the United States. We've made several efforts to devise interventions to help disadvantaged parents do more of the things that economically advantaged parents do. And as I will tell you, I believe those efforts have been largely unsuccessful. They've been expensive and time-consuming and have been inefficient in the sense that they have yielded little return, I think, on child development outcomes for the effort that's been expended. And I'll close with talking about what I think is a new approach that my colleagues and I at the University of Chicago are adopting, a new way of thinking about supporting low-income parents' engagement with their children to promote their children's early skill development. So I'd like to begin by showing you this figure. This is from a nationally representative data set in the US that surveys a very large sample of 4-year-old children and their parents. And these, age 4 in the US is when many children are in preschool, their first exposure to education. And what we see here are scores on the left-hand side of the figure on tests of literacy and mathematics and language, on the right-hand side of the figure on behavior by income quintiles. So what we see here is that those children who are in the bottom of the distribution, the lowest 20% of the income distribution, have scores that are substantially lower than their counterparts in the top of the income distribution, and the relationship is in fact fairly linear. So with each increase in quintile of income, children's test scores go up. When we think about behavior problems, we would like to see fewer of them. But what we see is that children in the bottom of the income distribution have substantially higher scores on measures of behavior problems than their peers in the top of the income. Although I will say, and as you may notice yourself, the gradient for behavior problems is not as steep as it is for cognitive test scores. And that's another fairly regular result that we see across many of the US data sets. It is nevertheless still significant and important. So that's sort of where I begin with the problems with which I am concerned. The second concern I focus on is the fact that, at least in the realm of achievement test scores, these gaps open up very early. As you can see here on the left-hand side of the gap, here we have a gap by maternal education. We're comparing mothers on the blue line who have a college degree versus those at the very bottom who have not yet completed high school in the United States. We see here a very large gap in children's cognitive test scores that appears at age 3 for the children. And what you will notice is that that gap barely closes as children progress through the school years. So I think this would suggest that We can't rely on schools to close the gap that emerges early before most children begin their prior schooling. One might wish that, at age 5, when children enter the formal schooling system in the United States, we would see these gaps shrinking. It's not what we see. It may well be that in the absence of high-quality schooling, these gaps would grow. We don't know that. But they certainly it doesn't appear to be the case that we can imagine that the schooling or the educational institution will address this problem. And this is really the second main point I'd like to make when I'm directing you towards my belief that parents will be the group on whom we should focus. The third important point is that at least in the United States, this inequality in children's skills appears to be growing over time. What we have here are really just 4 data points from 2 cohorts of children, those who were teenagers in the period, the mid-1970s, and those who were teenagers or mid-adolescents in the mid-1990s. So we have 2 generations here of observations from adolescent-age kids who are, again, in the bottom and the top quartile of the income distribution. There are 2 lines here because these data come from 2 nationally representative data sets. And the 2 data sets show the exact same phenomenon, which is that the gap in achievement test scores has grown over time. Okay, so the most recent cohort, the gap here, this is one particular outcome. It's the share of these children who will complete college. But you could really substitute almost any outcome here related to educational test scores, entering college, completing college. All the phenomena show the very same pattern, that at least in the US, this inequality in children's outcomes by income or by parental education appears to be growing over time. Now, why might this be so? We can say, if we think about parents, well, what might promote children's development? Parents have 2 resources to deploy. They have time and they have money. They have emotional resources as well, but when we think about quantifying these in the kind of data that we have access to, we typically think about expenditures of time and money. And what we know in particular is that highly educated parents in the United States, and I believe this is true among other European countries that also have national time diary data, the US has one such one, that college-educated parents have, since the early 1990s, substantially increased the amount of time that they're spending with their children on cognitively stimulating activities, activities that promote children's development, reading, talking, playing games and puzzles, doing culturally rich activities with their children. You will also see here on the lower line that parents with less education have also increased the time that they're spending. So in fact, this is a phenomenon that is characteristic of all parents in the US, but the highly educated parents are on a much steeper trajectory. So we have, if you care about the levels, you might say, well, this is not all bad news because everybody's going up, including the less educated. But if you care about inequality and you think that the gap matters, then you would still perhaps think this is a problem because on almost all dimensions, the college-educated and the children of the college-educated in the United States keep outperforming their peers who have less education and lower income. I will say one more thing from this large body of descriptive statistics that I'm summarizing, and that is that the gap between what college-educated parents do and what their less educated peers do, this graph shows the size, the magnitude of the gap between those 2 groups. That gap is largest when children are at their youngest years of development. And most developmental psychologists, of which I am one, believe that the early years are particularly important. They're not the only years of child development that matter, certainly, but there's a lot of evidence from psychology and neuroscience and other fields that there's a particularly special period that characterizes those early years of development when this kind of investment in development in cognitively stimulating, emotionally supportive relationships is especially important. So again, if we care about inequality, we might be particularly concerned that these college-educated parents are doing more of what matters at precisely the time when it matters the most. Now, in the United States, we've typically had a singular response to these kind of descriptive statistics, again, of which there are hundreds and thousands of research papers showing these mean differences across groups. In the US, we generally say the following: okay, so let's have more public preschool. Let's invest more in institutions outside the home. We have a program called Head Start, which is our biggest federally funded preschool program for low-income children. We increasingly have universal preschool programs, state-based programs that are open to all children regardless of income. And we've seen major expansions along this dimension. But I would say, for example, if you go to Washington, D.C. in the United States and you listen to the discussion that's happening at the federal level, you will hear only the words preschool, okay? And really, there's some strong evidence. I'll explain this figure to you in a moment. There is strong evidence that a very high quality early childhood preschool program for low-income children can make a long-lasting difference in children's lives. Perhaps the most famous programs from the United States are the two that are shown on this particular figure, which come from the Perry Preschool Program and the Abecedarian Program. For those of you who happen to know the work of the American economist Jim Heckman, you may know that he has championed the results from these programs. They're plausible because they were some of the first interventions to be conducted as randomized controlled trials. So we really have an experiment where we have random assignment to treatment and control. Children in these two programs were randomly assigned to very high quality out-of-home preschool environments. In the case of the Abecedarian program, for the entire first 5 years of their life, for 10 hours a day, 5 days a week for the entire first days of their life. The Perry Preschool Program was somewhat less intense. It looked more like a regular half-day preschool program. And as you can see here, we're just looking, we basically want to look at those who got exposed to the treatment, who participated in the intervention are shown here in red. And basically across the board, both in the Perry Preschool Program on the left and the Abecedarian Program on the right, those children had substantially better outcomes. Those children have now been followed until they were 50 years old. And they have significantly better outcomes than the control group, even at that age. Better health, better well-being, better satisfaction with life, more stability in their lives, and so on. And so it's not surprising that with such positive outcomes across such a long time frame, this kind of program easily passes a cost-benefit test. But I will say that the entire argument from the United States about why we should champion preschool really comes from these two studies, which is a little bit strange, I think, because these were only two studies. Each one only had about 100 families randomized to treatment and control. They were done many years ago, back in the late 1960s and early 1970s. So obviously the environment, the social context is vastly different. And they were extremely intense and extremely high quality. So even though they pass a cost-benefit test, they were nevertheless very expensive. And so one wonders, can we really offer such a program at a wide scale, given the cost? Sorry, so the red bars represent the outcomes for children who got the treatment. The blue bars represent the outcomes for children who were randomly assigned to control. And we have numerous outcomes here from two different programs. So treatment children were less likely to be placed in special education, which is an adverse outcome. They were more likely to be achieving at a higher percentile in the achievement test distribution, more likely to graduate from high school, higher earnings, owning their own home, not receiving public assistance. I mean, the pattern is the same across a whole set of outcomes from childhood through to age 50, as I said. So very impressive. And we have no other studies that have shown anything like this. But these have constituted a big part of the argument in the US for why we should have preschool as the solution to these achievement gaps.
You said that it's very expensive. Do you have any idea?
Approximately $10,000 per year per child.
$10,000 per year per child.
Yeah, not cheap. I mean, it passes a cost-benefit test, but it's not cheap. And quality isn't cheap in the US. I mean, you get in what if we can come back to this in the time we have questions, but it's a good point. So let me just say, I've kind of set up a bit of a straw man here, as I hope you gather as I'm following along. And this is what I mentioned to you at the outset. So all this focus, we have these achievement gaps. We have a big focus on preschool, but as it turns out, if you look at the share of time, I already mentioned this, that children spend in the company of their parents versus the amount of time that they spend in school, the time that they spend with their family vastly eclipses the share of hours they will spend in school settings across their childhood years. Okay, of course, as children get older, they spend time in peer groups and other institutions. But nevertheless, the schooling institution is not the leading place where we're going to find children if we look in the aggregate over their childhood years. And I'll just present one slide here that, again, summarizes dozens and dozens of descriptive studies showing that there are vast differences in the home environment. I already mentioned this between rich and poor children, those with college-educated versus less educated parents, in a whole range of activities that parents do to promote their children's development. We have studies that have counted the number of words that parents speak to their children, counted the type of words that parents speak to their children, how much time do they spend reading, in what ways do they elicit conversation with their children, in what ways do they discipline their children. And again, there's too numerous to mention the number of studies that basically show that low-income children have far less cognitively stimulating home environments and have less emotionally supportive home environments as well. I want to return and remind you of the figure that I began my talk with, just to bring our attention back to these descriptive differences. This is an important study by Jane Waldfogel and her UK colleague Elizabeth Washbrook, who looked at these data and said, okay, we have these differences across the income distribution in children's outcomes. Well, what accounts for them? So the ECLSB is a very rich data set that has many of the kind of demographic indicators that you might want to look at to explain these gaps. It also has very rich data on parents' reports of the kinds of interactions they have with their children. And so they wanted to do a basic decomposition of the gaps across income in these child outcomes. And what they found, they sort of ran a horse race among all the variables in the data set and sort of said, well, which one of the classes of variables in the data provides the biggest explanatory power for these income-based differences in child development outcomes? And what they found was that parenting was kind of the winner among all the different measures. So they found that this measure of maternal sensitivity and responsiveness, which is essentially how much parents are interacting with their children in a manner that is developmentally appropriate, explained very large shares of the income-based gaps in children's cognitive test scores. They also found that the measure of the home learning environment, which is a measure both of material goods, but also the time that parents spend using those materials, came in second place in terms of the kinds of measures that explain the income-based gaps in children's test scores. And this is relative to parental education, parental health, whether it was a single or a married parent household, many other demographic factors. There was really sort of a primacy of these measures of parenting. And so what I believe, what a number of people believe, and what we're really focused on in our lab is that the key to closing those gaps in child outcomes is really closing those income and education-based gaps in what families do with their children. And I want to say that I don't want you to think that I think preschool is unimportant or that somehow, the formal education is irrelevant and doesn't play a role. I don't believe that at all. I just think that a sort of singular policy focus on these out-of-home institutions is likely to be too little and too late. It's not really surprising because we sort of are reluctant to intervene in this private sphere of family life. It's also really hard to find families. Quite frankly, I never knew how hard it would be to actually find low-income families, to meet them and think about a program that you might engage them in, because in the US at least, they're not involved in institutions. So except from the healthcare system, there are very few institutions in which low-income families participate. And so it's easier to think about schools. It's frankly easier. We have more public policy mechanisms to imagine, well, let's just do schools. Let's think about class size. Let's get everybody a spot in this preschool program. I mean, it's not easy, but it's not as hard as sort of imagining creating a context for low-income parents where we can invite parents and provide environments for them to participate. So let me turn to, I believe it's my third point, about what we have tried to do, again, in the United States to support low-income parents, to engage in the kinds of activities that would better promote their children's development. And we have several well-known ones. One is called the Nurse-Family Partnership, which is probably the leading program. It involves parents, the program is designed so that parents, low income, this is generally for teenage mothers, for very low income teenage mothers, to participate from their time of their pregnancy through the child's second year. So it's designed to last nearly 3 years, involving monthly home visits. So a trained nurse or nurse practitioner is sent to the home to kind of sit down on the floor and help the mother understand how to parent. Mother is also expected to attend parenting classes and so forth. Nearly half of those who sign up for the program have dropped out before the program is even halfway through, which is maybe not surprising because who could possibly imagine sticking with the program for 3 years that is so time demanding. And I mean, it's not hard for me to understand why there's so much attrition. It's very demanding of mothers' time. Engagement in early Head Start, which is sort of the precursor to our Head Start preschool program, which also involves home visits by a nurse practitioner, is also rated by the practitioners themselves, rate the parents as not particularly interested or engaged in the program. So we seem to have a mismatch between what we have on offer in the United States for low-income parents and what parents actually want. And we draw this conclusion from these observations of very low participation in what we have on offer, high rates of dropout and attrition, and limited take-up of what is on offer. And we would argue that you might say, okay, well, policymakers have no business trying to change what parents do. This is somehow, again, a sort of a private decision. It's challenging, it's expensive. Parents don't seem to want to do it anyway. So why don't we just turn our attention back to preschool? You could say that. But you might also say that maybe we just haven't designed the programs in a way that really helps parents achieve their own goals. In our view, the optimal decision about how to parent your child is the decision you want to make. It's not about telling you what you ought to do or telling you to do something you don't want to do. It's about understanding how to help parents achieve their goals. And it turns out that's not the typical approach that we have taken in these parenting programs in the United States. And I'll tell you what I mean by that next. I'm actually going to skip to this slide so I don't run over time. What I will say is that in the US, we mostly have adopted what I call an information model. And that is that we make an assumption that economically disadvantaged parents, say, don't read to their children because maybe they don't know how to read. Maybe they don't believe reading is important. Maybe they don't understand the return on the time that they would spend reading. That's the assumption that many programs make. And what many programs do, you could also say, well, maybe parents don't have books. That's another possibility. So what programs generally do is they provide I'm just using books as an example. We can expand that metaphor to any number of behaviors. They provide the materials to families, and the nurse practitioner goes to the home and says, here's how you read, here's a style of reading that you can engage your kid in. And by the way, you didn't know that reading is important, so now I will tell you that reading is super important. Or you didn't know that talking to your child, even before the child can talk, is a very important thing to do, and you should do that. And so most programs take that kind of information model and then they stop there. That's kind of, they might provide the materials and then they tell parents what to do, and then it's kind of full stop. But I would say that each of us can find an example in our own lives where information about why one should or shouldn't do something has not been sufficient to motivate a change in our own behavior. So we see this phenomenon in the realm of health and exercise and saving for retirement, and maybe that's not as important in the European context, but all sorts of things we know we ought to do that we don't do. And every January 1st, we have a long list of things that we say, oh, I know I want to do these things, and then our gym membership has lapsed by the middle of February. So this is what I like about thinking about this way, and I'll get to explaining what I mean in a bit more detail. Thinking about this kind of behavior change is that it's really addressing a universal phenomenon, which is that we all have goals. And we all have roadblocks to achieving those goals. And in many cases, the route to behavior change is not just telling you over and over again that you should do something, but rather to helping you convert what you already know into a habit. So I'm going to foreshadow what the kind of work we're doing with that statement, because that's our kind of philosophical approach. It's also secondarily, as I said, it's not clear that parents listen to so-called experts when it comes to parenting advice. So we listen to health experts when we're considering, the importance of a healthy diet, or the importance of quitting smoking, or the importance of engaging or not in other health-promoting behaviors. Medical experts have a lot of authority when it comes to medically related outcomes. It's not at all obvious that medical experts, and remember I said that it's a nurse or a nurse practitioner who typically goes to the home to teach parents about parenting. It's not as obvious that parents listen to those kind of figures as much as they might listen to their own mother, or their sister, or their family and friends, the people who are closest to them in their social network. And finally, we know that there are differences by the kind of social network in which you're embedded and the level of education that you have in the rate of behavior change, even when you are exposed to the same information. So these are just, again, some problems that we've identified in the typical approach to supporting low-income parents in the United States. And I think, we don't have the kind of empirical evidence, but I think plays a role in this observation that these have not been particularly successful programs. And just as one example, in the kind of survey work that we do, just to rebut one of the statements I made previously, we actually do find across a range of outcomes that parents do understand the importance of these kind of cognitively stimulating activities with their kids. So in our survey of low-income parents, this is just one example of many, we ask parents, if you were to do, X, Y, or Z, here we have an example of reading, how much better would your children fare? We actually ask them what would be their children's rank in school. And we do find that parents understand the production of their time in producing better child outcomes. And we see this across a number of questions. So just, again, one small piece of evidence that it's not the case that economically disadvantaged parents don't know anything about what to do. And in our surveys, we ask them about their goals and aspirations for their children, and you won't be surprised to know they are extremely high. Low-income parents have the same high aspirations for their children as do economically advantaged parents. But what we will argue is that they encounter more roadblocks to achieving their goals and aspirations for a variety of reasons than do their advantaged peers. Okay, so just a few moments here on this kind of decision-making framework. And some of these next thoughts are really drawn from the decision sciences, sort of social psychology, and increasingly this subfield of economics, which is behavioral economics, which is really just a lot of social psychology, but really kind of trying to understand parenting through a decision-making lens, which is a more simple and less complicated way, I think, of characterizing parenting than the typical developmental psychology approach, which is my own field. In developmental psychology, we spend a lot of time talking about something called parenting style. And we sort of talk about parents as, well, you're this kind of parent or you're that kind of parent. You do this constellation of activities or you do that. You're a sort of authoritarian or authoritative parent. I find that not particularly useful when it comes to intervention. Because how do you, change a person from one kind of person to another? What we want to do, in my opinion, is think about parenting as an endless series of decisions. We make a decision every hour, every day, if you're a parent, every month, whatever frequency, a series of micro decisions at any given moment. Are you going to do this with your child, or are you going to do something else? And to me, what we want to think about is when we want to convert the not doing something to doing something, well, that's what our intervention should focus on, not on trying to make you a sort of warmer or more gentle or some sort of qualitative description of the kind of person you are. Okay, so we could say we're going to think about parenting as this accumulation of decisions over the lifetime of the child. But decision-making isn't perfect. Okay, as we can all say, as I suggested before, we don't always make decisions that are in our own self-interest. We don't always make the decision we say we want to make for any given activity. And in particular, we have this well-known bias in cognitive decision-making that says that we make choices today that are inconsistent with the person we imagine ourselves to be at some future point. Okay, so I want to exercise and be fit and so forth, but I'll go and have a pastry after my seminar, and or I want to save for retirement, but this attractive thing to purchase is so tempting. I'll spend my money on that now. So, these intertemporal inconsistencies in the language of economists are no different when it comes to parenting as in any other realm of behavior. We imagine our children being happy and healthy and successful and doing well in school, yet we might make a choice this afternoon or this evening not to read to our children, even though we know we should. Maybe we're tired or irritated or bored, and it's just, I'm just not going to do it. This is just a metaphor for thinking about parenting that I find very useful. And especially the idea that we don't always understand that what we do now as parents is related to some long-run outcome for our children. And this is made more challenging by the fact that children don't develop before our very eyes. We don't read a book today and then see that the child can read or score well on an achievement test tomorrow. We don't have that immediate reward of seeing the return on our effort. We do all these things now for some vague, uncertain future, and we just hope that it's all going to pay off. But we persist only because we believe that we're going to find this long-run payoff, not because we have the feedback that shows that we're being successful. So this is a very important problem. Again, related to the problem I just described, parenting is fraught with uncertainty. As I just said, we don't really know the exact outcome of any decision we make as parents, a very few, I should say, in general. And we know from cognitive science that in this uncertain framework, decisions are not always made optimally. We rely on these shortcuts. We rely on these heuristics. I mean, if we thought through every single decision we ever had to make, our heads would explode. We have to have shortcuts and heuristics to help us get through the day. But when we make these kind of computationally cheap decisions, we run the risk of making a decision that is not aligned with this goal that we originally professed to make. And again, these are universal phenomena. And what I'm arguing is that parenting should not be thought of any differently. I will also just say one more thing. I'm not going to focus on quite all of these points, but rather that in the context of poverty and stress and a low income and violence that characterizes many of the environments in which low-income families in the United States live, this kind of purposeful decision-making is made even more challenging. Okay? There's very interesting research on the role of stress and the various cognitive biases that arise from living under conditions of stress. And so when we think why I think we should care in particular about this decision-making framework in low-income families is that they may be more prone to suboptimal decision-making because of their social context, and also because the consequences of those decisions may be greater for low-income families. So those are two reasons that I'm especially interested in thinking in this decision-making context. Okay, I'm going to go on. I think I have like 5 minutes or so before we open up for discussion. 7 minutes, okay. So let me just say a couple more things before I tell you about a project that we've just finished in my research lab at the University of Chicago. And again, just to summarize before I get into this, we believe strongly, as I mentioned before, the optimal decision for any parent, and any low-income parent as well, is the decision that parent wants to make. Okay? We're not interested in thinking. Now, there may certainly be realms of parenting where information is sorely lacking and people really simply don't know about health or safety or some other important dimension of child development. And it would be really important to kind of have have a public campaign, a focus on bringing information to certain populations. But we believe that there's a sufficiently large scope for intervention to help parents convert what they already know and their high aspirations for doing a particular set of behaviors to habits that parents adopt every day, to kind of shifting how parents make decisions. And we're especially interested in habit formation because perhaps counterintuitively, once you form a habit, you don't have to think about it anymore. That's the very definition of a habit. So we're interested in these kind of micro behaviors that low-income parents know about, that they say they want to do, that they say to us at least that they understand the importance of doing, and yet we look and we observe that they're not doing it at all. We want to convert those zeros to a habit so that that cognitive tax of having to think about it is in fact lessened. And I will just say one other thing that I didn't mention before. These various kinds of parenting behaviors that I mentioned that most developmental psychologists believe to be important, like I keep talking about reading to your children because there is actually experimental evidence from, that reading has a return in terms of children's cognitive development. But any kind of cognitively stimulating interaction with their children. If we look at the time diary data, either from the United States or in the European countries, the margin between the economically advantaged and disadvantaged is the one that distinguishes those parents who never do something versus do something a little bit. Okay, so it's not that college-educated parents anywhere read to their kids for 3 hours a day. They just don't. But they read to their kids for 13 minutes a day every day, or at least on a couple days a week. We see this in the time diary data. And what we have is many fewer college-educated parents who have many days with 0 reading minutes. okay? So it's not like we're trying to shift the distribution from doing nothing to doing this vast amount, because nobody does that. We want to shift the distribution from having fewer days on which you do nothing and more days on which you just do a little bit with regularity. And to us, that's the habit that we're after. And that's the habit that matches parents' aspirations and their goals. And we frankly think that in many realms of parenting, that matches what parents are capable of doing. That's not demanding a huge amount of time or emotional or cognitive investment from parents on many of these things, okay? So let me spend my last 3 or 4 minutes talking about a randomized control trial that we completed last year in the city of Chicago called the Parents and Children Together Study, or PACT. And we were interested in testing a low-cost and what we call light-touch approach to increase the time that parents spend reading to their children. Okay, we picked reading kind of for all the reasons I've been alluding to, because we know that parents believe it's important. In fact, we know from survey data that most parents, including low-income parents, do have at least some access to reading materials. And most parents can read picture books that have few or no words. So as I'll tell you in a moment, we provided those materials to parents. We wanted to have as cheap an intervention as possible, okay? So that was one of our goals, is to say, look at what's already been done and how far opposite to that can we possibly do that involves as little human interaction between a paraprofessional and the parent and as little money as possible. And we did this in the interest of scalability. We just wanted to see if you did something that was very inexpensive and very light touch and drew on these principles of behavioral science and cognitive decision making, could you get anything in terms of outcomes? So we devised an experiment that lasted 6 weeks, and we had about 200 families whom we randomly assigned to treatment and control. We recruited these families from preschool centers in the city of Chicago. All the families in the study got to borrow a tablet, an iPad actually, for the 6-week period. And what we had loaded on the tablet was a digital library. Okay, so you had only one app. The tablet was stripped of anything else interesting. It was simply a vehicle for this digital library that when you opened it up had an infinite number of books in both English and Spanish, because Chicago has a very large Spanish-speaking population. And the books ranged in difficulty from, no words to many words, so that the parents' literacy level was not an issue. And the great merit of this particular app, which we did not develop, was that when parents sat with their children with the app and pushed the button and opened up the digital library, it automatically began a video recording of the book reading session. And what we did to measure the impact of our treatment was just count the number of minutes of video recorded book reading sessions that we had over the treatment period. It was critically important to us to have an objective assessment of the outcome of interest, and this study wasn't designed to be sufficiently long to have child outcomes as the outcome, because it was really a proof of concept to say, can we change parenting behavior? And then if it worked, imagine a more intensive intervention that could change kids' test scores. Okay, so what did the treatment actually involve? What it involved was really four dimensions that we drew from social psychology and behavioral economics, things that have been shown to be very successful in behavior change in other arenas. So the first thing we did was we had parents set a goal every week. They stated to our research group, our staff, how many minutes do you want to spend reading this week with your children? Just tell me, what's your goal for this particular week? We then sent the parents text message reminders 3 times a week, reminding them of their goal. Hi, it's us. Remember you set this goal. Just actually not telling them that they would be good or bad people if they met their goal, but just focusing their attention on the fact that they had set a goal. We did devise an app that gave parents feedback every week because we had this objective measure of reading minutes, we actually downloaded those data weekly, and we created an app that just presented the parents with a histogram that showed what was your actual number of reading minutes this week and what relative to your goal. Okay, so we gave parents feedback, and then we had one final dimension that we called social rewards. Basically, these parents were clustered across 8 different preschool sites in the city. Every week, we sent out a text message to everybody noting who in the group had the greatest number of reading minutes. So parents weren't identified by name, but rather by their study number. And so a text message would say, congratulations to parent number 105 who had the most number of reading minutes. If you were parent 105, you could be happy. And if you were not, you could think, oh, maybe I'll try harder next time to get this reward. So basically, this was all done with a text messaging interface. We did not have to see the parents at all during that 6-week period. There was no visits to the homes. This was extremely light touch. And what we found was a huge treatment impact. Basically, this is the number of reading minutes accrued by treatment and control parents over the 6-week period. In terms of levels, it was nearly 2.5 times higher level of reading minutes in treatment versus control. And in terms of magnitude, that amounts to a full standard deviation of the control group mean in terms of number of reading minutes. So this was an exceptionally large impact. I mean, to get an impact of a full standard deviation in the realm of child development or parenting interventions is quite unusual. So, you know, if you do the math, you will see, however, that 152 divided by 6 weeks, 152 total minutes over 6 weeks is not that much, which alludes to the point I made earlier. But when we look at the data, what we find is that basically treatment group parents read with their children using this app with some regularity. They developed the habit immediately, I will say. The treatment impact took effect the first week that the treatment was offered and then stayed fairly stable over that 6-week period. They were reading with their children a couple times a week with regularity, whereas the control group was reading irregularly or not at all, which is pretty much what we might have expected to find. I mean, we had no idea that we would get a treatment, an impact at all, because this was so light touch, so little interaction, and really just sort of technology-based. We didn't know. And I'm getting to my last slide here. The most, perhaps, important finding that we have, so we also do quite a bit of surveying of the parents. And parents fill out surveys, both quantitative and qualitative work that we do to try to understand the context of parenting and to try to understand any treatment impact that we get. One of the things that we measure in our sample is present bias. Okay, so the the degree to which parents are really thinking about the future or not, and we run these kind of stylized games with parents which use real money and basically say, would you like $5 now, or will you wait a week and take $10? And there's a sort of very stylized routine that one goes through. We did this for all the parents in our sample, and we got a distribution of present bias. We then divide the sample into basically those who are above and below the mean on that distribution of present bias. And what we find that the treatment impact was the strongest for those parents who are focused on the present and not the future. And this is not surprising if you think about it, because those are the very parents who need the thing we gave them, okay? So it's those parents who are not focused on the future, who need to make a goal, be reminded of their goal, and given the support to stick to their goal. Parents who are already focused on the future didn't benefit to nearly as great an extent from our intervention because they were already doing more reading, because they were understanding to a better extent the relationship between now and the future. And so this is one of the reasons we think it's, you know, we sort of say, well, we think this is some evidence for what is an important cognitive bias standing in the way of the kind of decision-making processes perhaps universally, but perhaps especially in low-income parents, and what kind of intervention can we devise to help promote new habits. I'm going to just conclude. I think this is supposed to show up. So this is our, there's a little typo. This is really the goal of our lab, as I said, to kind of close this gap between what we call aspirational parenting and actual parenting. We're interested in these behavioral tools, both because they're easy to implement. You don't need to be an expert to send text messages or even to devise text messages, because they can only be short and you only have so many words to work with. But we got quite a substantial impact. We don't know if this will last. It was really a proof of concept study. It only lasted 6 weeks. We did a little sort of unplanned follow-up. 3 months later, we invited everybody back in the study, and we looked at treatment and control over a 3-week period with the tablets, and that treatment benefit indeed had persisted. It had dropped. We lost a lot of sample because we actually didn't plan to do a follow-up. We were so uncertain whether the treatment would work initially that we didn't promise to do a follow-up because we weren't sure we'd have even any initial impact. And of course, we haven't looked at child development outcomes in the short or the long run in this study. But this is the kind of work we're doing in our lab. We think it differs dramatically from the typical approach. There's lots of interesting questions that arise from these kinds of studies that maybe we have a little bit of time to talk about. But that's what we're doing to really tackle this problem of inequality across family background in promoting children's human potential. Thank you.